Well, we have been talking about breast health and fundraising efforts for Komen for the Cure. Now we want to make sure that you are aware of your risks for breast cancer and how you can make sure that you're doing everything you can to take care of you. Joining me from Riverside Radiology is Dr. Kristen Fults-Ganey and Annette Fusco, Manager of Breast Health Services and Cancer Genetics at Ohio Health. It is a pleasure to welcome both of you.
Thank you.
This is a very important topic, and I think no matter how often we talk about it, I think women need that gentle reminder, you know, to take care of themselves. Annette, what services do you offer for women at your clinic?
We provide screening mammograms, and if we do find an abnormality on the screening mammogram, we will follow up with a diagnostic mammogram and an ultrasound as needed or recommended by the radiologist.
And I know there's just been so much confusion, Doctor, about how often women should get those mammograms, how old they should start. What does the latest research show?
Well, there's some controversy, and in part that stems from recommendations put forth by the United States Public Health Service Task Force at the end of last year. And the biggest change that they recommended was that women not begin screening until the age of 50. Now, every other organization, to include the American Cancer Society and we at Riverside Radiology, continue to emphasize that women should get annual mammograms beginning at age 40. And this is primarily because a significant portion of women that we diagnose with breast cancer are in their 40s. In fact, 20% are in their 40s. So I think that would be missing an opportunity to detect breast cancer early with this life-saving tool.
And I think after everyone heard that, they all thought to themselves, you know, I'm going to do what's right for me. And if I feel I should start at 40, I'm going to start at 40, especially if there's a history in the family. And now when we come to some of the discomfort of the mammogram,
That's right.
you know, you have something and it's sort of new, but it shouldn't keep people away from coming to see you.
That's right. It's a moment of discomfort, some ladies do say, but we provide every lady with a free mammo pad at Ohio Health.
What is that? I've never used it.
It's a soft
I've had mine,
pad.
actually.
It's placed between the woman and the mammogram machine, and it's cushioned to make it more comfortable. So this is something that we provide free for every lady, and we're hoping that they're more comfortable.
It looks like it would make a difference.
It does make a difference. Women do report that it's more comfortable.
I'll bet. Oh, now, Doctor, I'm going to turn to you again when we talk about mammograms. Screening mammograms, digital mammograms, it's all confusing to folks, to me.
Well, there are two different ways that we can acquire a mammogram. The older way is to use a film technique. The newer way is a digital mammogram. And just as the name implies, we actually look at these images on a computer. It has improved tissue contrast, and we're able to better identify breast cancers with a digital mammogram in some subsets of women, particularly in women that are very young, so premenopausal women, perimenopausal women, or women that have very dense breasts of any age.
When does the ultrasound come in? After you've already found something that's an abnormality?
Typically, we use ultrasound as a diagnostic tool. So a woman has a palpable lump, or we see an abnormality on the mammogram. That's when we use an ultrasound. We don't usually use it as a screening technique.
Okay. Now, Annette, let's go to the self-breast exam part, because there, again, maybe a misconception that women themselves cannot self-diagnose. So they just say, you know what, I'm going to do my mammogram, and other than that, I don't have to think about it. But there is a lot of truth to the fact that a self-exam can bring results.
That's right. We recommend, or the American Cancer Society recommends, clinical breast exam annually by your physician, and also doing monthly self-breast exams that your physician can educate you on, or if you need education, you can call us at the breast center. We'd be happy to teach you. Or
it really isn't hard to do, right? And I know you can even go on the internet and probably find ways that are easy to do that.
We have handouts for ladies, and we could talk them through it.
Doctor, do you know any kind of statistics of how many women do find their own lump in self-diagnosis?
You know, anecdotally, working at the breast center on a daily basis, I have women come in all the time who find their own lump. So I think it's important to familiarize yourself with your own breast, and that way you'd be able to detect an interval change. And probably monthly self-breast exam is a good idea.
And there's not a better time to schedule than right now, and we've put that phone number up, and I know that you feel the same way. After the age of 50, Doctor, is it every year, every other year?
You know, I think beginning at age 40, like we talked about, it should be every year, and it should be continued on an annual basis. And that's also in accordance with the American Cancer Society.
Okay, well, that phone number's up. We hope people take advantage of it to visit both of you if they need to. Thank you for sharing that information, very important information.
Thank you.